Chicago and Yoga Habitat, we are going to offer the yoga protocol set up by Ayush Ministry at Delhi. And today, Heidi is going to present all the poses. And to tell you a little bit of Yoga Habitat has been practicing, teaching, spreading the message of yoga in Chicagoland for past 18 years. And this year, we are about to inaugurate a facility based on yoga therapy and Ayurveda in Hinsdale, Illinois. And this place now has a physical place. Yoga Habitat has a physical place at Yoga Veda. I have been doing yoga ever since I was a child, and I followed the teachings of Bihar School of Yoga. And now about Heidi.
Hello, I'm happy to be here today, and I have also been practicing yoga since a child in gratitude to my mother, who shared her love and her understanding of yoga. So I'm very honored to be here today.
So today, let's begin with a small prayer. So join your palms together, close your eyes. We'll do the 3 chants of Om. Take a deep breath in, exhale. Another deep breath in and exhale. Another Om coming in. So take a deep breath in. Inhale and exhale. Bring your awareness with this next chant of Om to the mat and the practice of the yoga asanas. Rub your palms together, put them on your eyes, glide your hands down your face and open your eyes, and we will start the session of yoga. So please stand. So the first set of poses is neck rotation, and for this we are going to do Griva Shakti Vikasa poses, neck bending. So stand with your feet 2-3 inches apart. Keep the hands straight beside the body. This is called Tadasana. Keep your palms on the waist now. While exhaling, move the head forward slowly. Try to touch the chin to the chest. While inhaling, move the head up and bend back comfortably. Repeat. To the next, this time we are going to do the right and left bending, stretching with the neck. So while exhaling, bend the head slowly to the right. Bring the ear as close possible to the shoulder without raising the shoulder. Do it on the other side. While exhaling, you're bending, and as you inhale, you come back to the normal position. One more time. Third one is twisting the neck side to side. So keep the head upright. While exhaling, gently turn the head to the right so that the chin is in line with the shoulder. While inhaling, bring the head to the normal position. Similarly, while exhaling, turn the head to the left. Inhale and bring the head to the normal position. One more time at your own pace. We are now going to do the neck rotation. Exhale and bend the head forward to touch the chin to the chest. Inhale, slowly rotate the head clockwise in a circular motion. Exhale while coming down. Do a full rotation and then counterclockwise. Inhale, go back. Exhale, come down. Do it one more time at your own pace. This practice makes the bones, muscles, and nerves of the neck and shoulder healthy. These practices are helpful in cervical spondylitis and frozen shoulders. You can also do it sitting on the chair. And moving on to the next, we are doing Kati Shakti Vikasak, the trunk movement. Keep the legs 2-3 feet apart. Raise both the arms up to shoulder. Keep them parallel. While exhaling, twist the body towards the left side so that the right palm touches the left shoulder. Come back with inhalation. Move to the other side. This is round 1. Repeat it one more time at your own pace. Do it slowly with coordination of breathing. Cardiac patients should do with care. Avoid this practice in case of severe back pain, vertebral and intervertebral disc disorders. Knee movement for the next one. So come back out of this, palms on the side, hands down. Inhale. So the next one is like a chair pose. So inhale, lift your arms up to the shoulder level, palms facing downward. Exhale, bend the knees and bring down the body to the semi-squatting position. In the final position, both the arms and thighs should be parallel to the ground. As you can see, Heidi is doing it a perfect pose. Inhale and straighten the body. So in this, we are exhaling to go down, inhaling as we come down. Do not hold too long. Do it according to your body's strength. This pose is also called a chair pose and it helps to strengthen knees, hip joints. Avoid this asana in case of acute conditions of arthritis. Do it one more time. This pose also helps to improve neuromuscular condition, balance, endurance, alertness, and concentration. Avoid this practice in case of arthritis and vertigo. We are going to do the next pose now, Padhastasana, the hands to feet pose. Pad means feet, Hast means hands, therefore Padhastasana. Stand straight with feet 2 inches apart. Inhale slowly and raise the arms up. Stretch up the body from the waist up. Exhale and bend forward until both palms rest on the ground. Stretch the back to make it straight as much as possible. Maintain the spinal pose for 30 seconds. That is the goal. Those who are suffering with stiff back should bend according to their capacity. Now inhale, come up slowly to the upright position. And arms down. We'll do it slowly. One more time. This pose makes the spine flexible, improves digestion, and helps in overcoming menstrual problems. Please avoid this practice in case of cardiac disorders, vertebral and disc disorders, abdominal inflammation, hernia, ulcers, glaucoma, myopia, and vertigo. Slowly come out of this pose. The next pose is triangle pose, the Trikonasana. Stand with your feet 3 feet apart. If you're tall, you can go even wider. Inhale slowly and raise both the arms sideways up to shoulder level. Turn the right foot towards right side, keeping the leg straight, or you can bend if you have any problem with your knee joints. Now slowly exhale, bend to the right side, place the right hand fingers just behind the right foot. The left arm straight in line of the right arm. Turn the left palm forward, turn your head and gaze at the tip of the left finger, middle finger. Remain in the pose for 30 seconds. Breathe normally. Now inhale, slowly come back up. Turn your foot, arms down, feet together, and repeat to the other side, left side. This pose makes the spine flexible, strengthens calf, thigh, and waist muscles, and improves lung capacity. Avoid this pose in case of slip disc, sciatica, and after undergoing abdominal surgery. Do not try beyond limits and overdo the lateral stretch. Slowly come back up, arms down, turn your foot and feet together. We are now going to move into this seated poses. And the first pose in this sequence is Vajrasana. Vajrasana. So first we begin with the Dandasana. So in this you see Heidi has her legs straight out, toes are pointing upward, spine straight. Fold the right leg at the knee and place the foot under the right buttock. Similarly, folding the left leg. Place both the feet so that the big toes touch each other. And you're seated on the place created by both your toes and your foot. Spine is straight. This is one of the few poses you can do right after eating, and it helps in digestion, strengthens thigh muscles and calf muscles. Person suffering from piles should not practice this asana. Neither should the people with knee pain, injury, or arthritis. Do not push yourself. Do as best as your body allows. From Vajrasana, we are going to move to Ustrasana, the camel pose. Stand on your knees. Feel comfortable and balance your body. While inhaling, bend backwards, place the right palm on the right heel and left palm on the left heel and exhale. If you cannot put your palms, put your hands onto your heels, your ankles. Be careful not to jerk the neck while bending backwards. Hold the pose as long as you can. And slowly, as you inhale, come back up and get back into Vajrasana. Slowly, we are going to repeat it one more time. Ustrasana is extremely useful for defective eyesight. This is useful in relieving back and neck pain. It helps to reduce fat over the abdomen and hips. It is helpful in digestive problems and cardiorespiratory disorders. Those suffering from heart disease or hernia should not practice it. Slowly come back out of this. So now we are going to do Uttan Mandukasana. So in this, you are going to turn towards the front. You're still in Vajrasana. Spread the knees out as far out as you can. Raise your arms up. Both the knees are spread wide apart, big toes touching each other. So you're holding the palms at the back. Maintain the pose for 30 seconds. One hand holding the other. Slowly bring your arms down. Go back into Vajrasana. And this time as you do it, only the hand position change at the back. You will hold one hand with the other. This is how it will look on the side. This asana is helpful in back and neck pain, especially cervical spondylitis. It improves the diaphragmatic movement and lung capacity. People with severe knee joint pain or arthritis should not try this pose. You should try it in Sukhasana. Slowly come out. The next pose are in prone position, and we will start with Makarasana. In this, you will lie down on your stomach, feet apart, toes pointing outwards, heel inside. This is one of the very relaxed pose. Your head is resting on your palms. Keep the eyes closed and let the body completely relax, all the muscles relax from all the previous poses that you have done. This pose is recommended if you have back problems. It is also indicated to counter stress and anxiety. Do not practice it during pregnancy and frozen shoulder. We will move to the next poses in this position. We are going to get into Bhujangasana now. So bring your feet together, toes together, palms on the side. Slowly, as you inhale, lift up. You can also put your arms up to your elbow down and lift the body. This is stage 1. And with practice, you can hold the body weight on your palm. Slowly go back down. And we are going to repeat with the breathing. Inhaling, going up, exhaling, coming down, but holding the pose for 30 seconds. This pose relieves abdomen. It relieves stress and reduces abdominal fat, release constipation. Those who have undergone abdominal surgery should avoid this asana for 2-3 months. Those who suffer from hernia also should not practice this asana. Moving on to the next one. So slowly go back down. Bring your feet together, palms on the side. We are going to do Shalbhasana, the locust pose. This pose is started in Makarasana, as you have seen. You put your chin on the mat. So you're looking straight out. Palms will take the support and slowly you will be lifting the legs up. Pull your kneecaps and squeeze the buttocks to improve the pose. And go back down. But you can put your forehead to relax your neck muscles. We'll repeat Shalbhasana one more time. You can also do Shalbhasana one leg at a time. So slowly you will lift one leg up, hold it. Proceed with caution in case of severe lower back pain. People with high blood pressure, peptic ulcer and hernia should also avoid this pose. And now we are going to do the supine poses. So slowly get back onto your back. Yoga is a practice of relaxation. In this practice, we are friends of our body. We are not commanders of the body. So listen to your body, adjust your body accordingly for every pose. Though there is a perfect pose, perfect position in every pose, but do the best that your body can do. We are going to do Uttan Padasana, in which we are going to lift the legs up. So this is when your legs are at 90 degrees. You will bring them at 45 degrees. Hold the pose. This pose, Uttan Padasana, helps the Manipur chakra. It is helpful in relieving abdominal pain, gases, indigestion, or diarrhea. It strengthens the abdominal and pelvic floor muscles. It is effective in overcoming depression and anxiety. Slowly come back down. There are two ways to come out of this pose. One is to keep your legs bent, another one is to keep your legs straight, whichever your body is best to do. Now we are going to do Pavan Muktasana. For this, legs straight out. Lift your right leg straight up. Bend your leg at your knee. Hold your right knee with your hands and bring your knee as close to the chest as you can. Lift your shoulders up. Try to take your knee as close to your nose as you can and hold the position. Slowly bring your shoulder back to the mat. Release your knee and bring your leg down and repeat with the other leg. You will feel the stretch in your lumbar region. This is also very good if you keep your attention to your pelvic and lumbar region. Slowly come out. Release your knee and straighten your leg. Now lift both your legs up. Bend your legs at your knees. Hold your knees and bring them close to your chest. There are two places to, in this we have two stages of relaxation. This is the stage one where you bring your knees close to your body. Not everybody can take their knees all the way, but this is a very good starting position. If you're an advanced practitioner, you're going to take your knees further down to your chest and lift your shoulders up and try to take your nose in between your knees. Avoid this pose in case of abdominal injuries, hernia, sciatica, severe back pain, and during pregnancy. Slowly come out. Release your knees and go back to the straight, relaxed Shavasana. Give your body some time to relax. Slowly come back up into seated, and we will do one more pose in this, Halasana. So bring your feet together. Halasana is an advanced pose, so do the best you can. So lift your legs straight up. Try to take your toes as close behind your head as you can, constantly supporting your lower back. Feel the muscles stretching all throughout the back of your body. Slowly Bring your legs straight up and down. We are going to do one more pose on the stomach. Relax, let the muscles fall back in place. After halasana, sometimes it is advised to do the boat pose. So bring your arms straight out. Join your palms together, feet together, lift your hands as well as your legs behind you, balancing on your belly button. Hold it for a few seconds. Do not push yourself and slowly go back down. Bend your legs at your knees. Hold your ankles with your hands one at a time. And slowly lift up. And go back down into Makarasana. So feet apart. Now bring your feet together. Turn on your left side and come back to the seated position. Our next set of exercises is of breath work. So we are going to do slow breathing as well as some bellows breathing. So we begin by sitting in a very comfortable position. Take a mat or a roll or a blanket under your tailbone and completely relax. Wait for your breath to come back to normal. So eyes closed, awareness is on your breath. Give yourself a few minutes or moments depending on how your breath is. Your goal in this is to bring your breath back to normal breathing. We will begin with Nadi Shodhan or Anulom Vilom, the alternate nostril breathing. Left hand stays on the knee, right hand comes in Gyan Mudra. Bring the index finger at the base of your thumb. Right hand goes up. Right hand thumb closes the right nostrils. Slowly inhale through your left. Close your left nostril. Slowly exhale. Inhale from your right. Exhale from your left. This is one cycle. We'll do it a few more times. So inhale from your left. Close left. Exhale from your right. Inhale from your right. Exhale from your left again. And now do it at your own pace a few times. Your breath is not forced. It is very gentle, regular breath. Awareness on the breath as it goes in and out. This is a wonderful breathing exercise to bring stillness, peace. It helps in lowering the stress levels and anxiety. It is a wonderful breathing technique to improve concentration. Practitioner is supposed to finish the breathing cycles by exhaling from the left. Those of you who have been practicing this pranayam, you know that you do not want to come out of it. Take your time. Become aware of the stillness. And now we will do Kapalbhati, the bellows breath work. In this, the goal is to constantly breathe out as you contract your abdominal muscles. So you will push the air out by using your core gently, and you will make hissing sounds. I'm doing it louder than usual, but do it gently. To begin with, do 3 sets of 20 exhalation and improve your capacity of doing this up to 200 in each set. Keep on taking gaps in between and then continue one more time. Heidi is doing set number 2. Kapalbhati purifies the frontal air sinuses. It helps to overcome cough disorders. It is useful in treating cold, rhinitis, sinusitis, asthma, and bronchial infections. It rejuvenates the whole body and keeps the face glowing and vibrant. It strengthens the nervous system and tones up the digestive organs. Though it has a lot of benefits and it is good for everybody, but people with cardiac conditions should not be doing it. If you start feeling giddiness, high blood pressure, vertigo, chronic bleeding in the nose, epilepsy, migraine, stroke, hernia, gastric ulcer, please do not do it. Another care to keep in mind is please do not do it if you are pregnant. Kapalbhati Pranayam. Slowly open your eyes. And this is summertime and we want to keep our bodies cool. Many times you will not have this opportunity or you're feeling very thirsty. For this, we are going to do the Sitali Pranayam, in which you stick your tongue out and roll it into a tube and inhale deep inside. Close your mouth, slowly exhale from both your nostrils. This is your own personal air conditioner for your body. Do it a few times. This is a wonderful breathing technique for people with high blood pressure. It satisfies thirst and appeases hunger. It relieves indigestion and disorders caused by phlegm or bile. It destroys the disorders of gulma. It is beneficial for skin and eyes. But one caution here, people who are suffering from cold, cough or tonsillitis should not do this pranayam. We are moving on to Bhramari Pranayam, which is an amazing breathing technique for bringing calmness, focus, and making decisions. It is just like a bumblebee that comes around when you're out and open during summertime. So once again, you're sitting in the same position. You're going to take a deep breath, but you're going to use your hands in it. So your thumb of each hand will close the ear and your pinky finger and index finger will close the eyes as we chant the mantra Om. In chanting the mantra Om, the last sound of is elongated and longer, just like a bumblebee. So we will do it one more time. So pinky finger and ring finger is only covering your eyes. So take a deep breath in and gently chant the mantra Om. Each sound has a benefit. You can chant gently or loudly. We'll do it 2 more times. This practice of Brahmari relieves stress and helps in alleviating anxiety, anger, and hyperactivity. The resonance effect of humming sound creates a soothing effect on the nervous system and mind. It is a great tranquilizer, found good in the management of stress-related disorders. It is a useful prep pranayam for concentration and meditation. Word of caution, please do not do this practice in case of nose or ear infections. As we are approaching towards the end of the practice, we are going to do a few minutes of dhyan, the meditation. So sit with your hands, palms in each other, one hand holding the other in your lap. The tip of the tongue touching each other. Awareness on the breath. Become aware of the sounds around you. Look for the sound farthest off and move to the sound closer to you. Maybe you have your AC running or heating, the sound of the fans. Bring your awareness closer to your body. Become aware of your own breath, your heartbeat. Feel the pulsation in your fingertips. Slowly go deep inside with your breath. Awareness on the breath as it satisfies when you take a deep breath in. Very soon an urge to bring that breath out. Satisfaction of pushing that breath out. And an urge to breathe in. Stay with those thoughts for a few breath work. Stillness. We end the protocol of yoga with the sankalpa, the commitment. I commit myself to remain in a balanced state of mind all the time. It is in this state that my development reaches its greatest possibility. I commit to do my duty to self, family, at work, to society, and to the world for the promotion of peace, health, and harmony. Close this session with the chanting of this mantra for the peace, well-being, and health of all. सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्ति 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 Rub your palms together, put them on your eyes, glide your hands around your face, slowly open your eyes with a big smile. Thank you so much for practicing this session with me. This is a very basic sequence, right, Heidi? It's not complicated. But the good thing about this whole protocol is it's the simplest. Most of the people can do it. And when the sequence is simplest and you do it more often, it gives you the best of benefits. So go do some yoga with your children, grandchildren, with your friends, in a park, inside, wherever you do. We thank the Consul General of India at Chicago for giving us this opportunity to practice a little bit of yoga session with you today. Thank you. Om Tat Sat.